So my name is John Schmid. I'm a registered nurse with a background in emergency and critical care, and I teach the emergency care workshop for multiple providers, for primarily registered nurses, but also it's open to paramedics and any type of potentially LPNs that may be working excuse me, in remote or rural facilities. First day is general emergencies, so from a systems-based approach. So we cover emergencies based on, from a respiratory perspective, so airway emergencies, gastrointestinal emergencies, cardiovascular emergencies, orthopedic, musculoskeletal, and so on. So the first day is all focused on non-traumatic injuries of that nature, and is for providers of different skill levels. So you can be a beginner, but you can also be an advanced provider. It's a kind of a homogeneous grouping of skill sets. The second day is rooted exclusively with trauma management. And so the trauma management component of the program is rooted in TNCC and ATLS, so Trauma Nursing Core Course principles, which are rooted in Advanced Trauma Life Support principles, which are the physician equivalent of the TNCC program. So it's a very detailed day, and it's very fun. It's all on trauma, which is one of my passions, is trauma management in emergency care. So one of the things I think that participants want from the emergency care workshop and how I've tailored the curriculum is around crisis and emergency management in general. And there's quite a bit of content embedded into each module of the program that teaches participants on how to handle stress and how to handle high acuity situations in a calm and collected manner. And we focus on that step by step from an ABC perspective, which is a simple perspective, but it's fundamental to managing crisis and emergency situations. And I think that's one of the main sources of anxiety with people that are new to emergency care. They have a fear of emergency, which is inherently normal in most situations. And that's one of the skills that participants take away from this program, is they have a higher confidence level in how to work under stress and work effectively under stress, so that they can implement a lot of the knowledge and ultimately save lives. Well, I've learned a great deal from the participants in the emergency care workshop. The participants, they come with a wide range of experience. They may not be emergency nurses, they might be nurses in other acute areas or non-acute areas. And the things I've learned is a passion for learning. It's great to see people come to these workshops and participate so eagerly. Like, it's really good to see engaged staff and engaged nurses. It's fabulous. And they've been dealing with them for hours, you know, and the patients are near death, and you fly in there, and then you see what they've done and see what the little resources they have, and you're like, and I've worked in the north, and I've worked in small communities as well, like way up in the bush, and when you're the only person dealing with a traumatic injury or a non-medical or a medical airway emergency is just frightening. So when you've done it before and you've got some skills and tools to apply to situations, it makes a huge difference. So that's my big focus on that. So when I give the introduction to the course, when I teach, then you can just see people going, oh yeah, good, because that's what they want.